let me put this into context. This is almost like a one-off. This is embedded in the business model. 23 is already behind us, and 23 was marked by very high inflation, triggered by, as you said, high energy costs. And if you're in the regulatory business of the hospital, you will get reimbursement going forward also on inflationary pressure. So what the government decided is to match when hospitals do incur the costs and to pull forward what would have been coming in the coming years, so to match the costs incurred and the adapted revenue. And that came with a little fine print saying if you take the state aid, then obviously you have to stall the dividend and bonus payments. So in essence, we made a decision, and I've said from the very outset, we're going to take the decision in the best interest of the shareholders. And given the amount, because we are the largest hospital chain in Germany, it's roughly 300 million cash and earnings. And we have a clogged up balance sheet full with debt. So in the best interest of long-term shareholders, it was to stall the dividend, and obviously it also has an impact on the bonuses, but only for the executive board members.
Let's rewind 1 year to Davos 2023, when you made a pledge for the zero health gaps. The problem is that now, 2024, the most recent World Economic Forum Economic Outlook report talks about rising inequalities. Do you think that we're moving backwards in terms of closing that health gap?
I think everybody needs to focus on what he or she can do. And with Fresenius, we are perfectly positioned to really close that gap. What is top of my mind is to really combat health inequality. And if you look at our portfolio, we're market leading globally in affordable medicine for critically and chronically ill patients. So it's about affordability. Also on the latest technology, when you talk about biopharmaceuticals, which is the next wave of all the biological drugs now coming off patent. And we are really talking about serious disease patterns like oncology and autoimmune diseases. By the same token, running the largest hospital chain in Europe with a really dense network of outpatient and inpatient, that is giving access to people. And that's why this health equity topic is so close to our mission, advancing patient care.
Can I ask you about innovation and disruption? AI is coming, and one of the most common things that is said right now is that it will be transformative for healthcare. Do you see that?
Absolutely. I wouldn't even say it's coming. I would say it's there. And if you look at the statistics at the investment spent in 2022, that's the latest statistics we still have, the biggest sector where the money flew into was healthcare. And it will be really pivotal, and I'm telling you, in the next decade, where it already started. Why is it so? Because it's going to impact the entire business system and value chain. It will lead to dramatically better outcome, and it will drive productivity in the system. Think about that. More than half of our clinical decisions are still imprecise. So AI and the use of structured data can help make more and better precise decisions, can help the patient to get to personalized treatment. Today, already on oncology care, you talk about tumor boards where, from different kind of faculties, the MDs come together and discuss the disease. And now think about somebody sitting at that table, which is called your avatar, coming with a lot of data and knowledge to really get more precise decision-making and personalized healthcare.